Your Excellency, the Speaker of the House of Representatives, Your Excellency, your distinguished Senator Olori Egbe, here in his own capacity and representing His Excellency, the President of the Senate, the Chairman of PTF, and Secretary to the Government of the Federation, and our landlord, the Honourable Minister of the FCT, Honourable Minister of State, and Royal Fathers here present, Permanent Secretary, our development partners, Chairman of the Board of National Hospital, and CMD and staff. We thank you all for accommodating us here today. The long-awaited day is here, on which Nigerians can now join others in the global community to be vaccinated against the dreaded COVID-19 virus. For us in the health sector, it is a relief and the marking of the start of a tedious but hopeful exercise to see our fellow citizens develop immunity against this virus. As has already been announced, I am happy and also relieved again to announce that at 12 minutes past midnight today, I got the text message informing me that NAFDAC has certified this vaccine for use. Otherwise, we would not be sitting here today. It will have to be postponed. It has been a harrowing past 1 year to helplessly follow the gradual increase of COVID-19 casualties in our country, especially among health workers in our midst, which was also depleting the human resource for health and making it all the more harder to tend to other people in need of health care. Every life lost to this pandemic mattered, but the loss of health workers compares to soldiers lost at the war front and is therefore laden with sentiment. The vaccination campaign we kick off today will be in 4 phases and will align with the planned arrival of vaccines in batches. Each phase targets a specific segment of our eligible population to ensure equity in the vaccine deployment. The defined frontline healthcare workers are prioritized globally for vaccinations against COVID-19 due to their higher exposure to the risk of infection with COVID-19 in the course of duty. It stands to reason that this protection is not only for their own sake, but also for our own sake, since any one of them absent due to illness means, again, a depletion in their ranks and can forebode staff shortage. It therefore makes sense to cater first to those who cater to us. The next prioritized group are those who, if they become infected, are at higher risk of severe disease. These are the elderly and the vulnerable, as defined by presenting with pre-existing conditions like obesity, diabetes, chronic kidney, respiratory, and heart disease, and cardiovascular diseases and other medical conditions as identified by their doctors. Ladies and gentlemen, all eligible groups must get vaccinated as and when due, while the non-eligible groups should respectfully await their turn. The vaccines are more than enough to go around, and they'll be coming in phases. Persons under 18 years and pregnant women are for now not eligible except they have been medically certified as vulnerable due to one underlying ailment or the other. The reason for them not being generally eligible now is because there is no scientific assessment yet of the safety for persons under 18 years old of age and pregnant women. That said, let us encourage the elderly and those with known underlying illness to be vaccinated and so to shield the community, the loved ones and ourselves from COVID-19. We have taken steps to ensure vaccine security and accountability, but we must also warn against any kind of foul play or underhand dealing in this exercise. Any infraction will embarrass us and will be sanctioned swiftly. This campaign must be done according to the books which have been so elaborately put together by the Ministry of Health and the National Primary Healthcare Development Agency. So I urge citizens to be vigilant and to report any unwholesome practice or attitude to the police or to the Federal Ministry of Health. These vaccines are our common assets, and the responsibility is on every person to protect them and ensure proper use. The Federal Ministry of Health and NPHCDA desire an impactful and successful vaccination campaign. It is important that all sectors key into the federal government's homegrown strategy for the COVID-19 vaccination, which is known as the TEACH phenomenon, and the Electronic Management of Immunization Data System, EMID. I urge all states of federation and the FCT to align with the initiatives in order to have a peaceful and orderly campaign across the country. I want to use this opportunity to thank the dedicated staff of the Federal Ministry of Health, led by the Permanent Secretary, Mr. Abdulaziz Mashi, the NPHCDA, led by Dr. Faisal Shuab, and particularly our donors and our partners who have walked this very hard way with us. I also remember recognized members of the UN agency who have always supported us with their single basket idea, and also with the technical support they have always given us. Worthy of recognition must be the vibrant members of the media who I see arranged right in front of me, almost more than the number of us sitting on this side, who have done their duty by following developments in the health sector since COVID-19 broke out in February 2020. Today is primarily a day for vaccinating our healthcare workers. I want to tell you that we are very proud of you all and wish you well and urge you to continue to give your best to the country and to fellow men, whatever the circumstances. Despite the beginning of this vaccination exercise today, I would like to emphasize that we are not out of the woods. Yes, there is light at the end of the tunnel, but we are still in the tunnel. We are not out of the tunnel. We need to continue as strictly as before with the non-pharmaceutical interventions, the public health measures, the wearing of masks, even if you have been vaccinated, the social distancing, the avoidance of crowd, and all the use of sanitizers and measures that have been expressly sung over the months in order to have the full benefit of this exercise. We are aiming for herd immunity. We are aiming to vaccinate 70% of the population. We are also aiming to look after the interests of our neighboring states in the West African sub-region with whom we have a lot of human traffic. Because as has been said by the Director General of the World Health Organization, no one is safe until all of us are safe. Thank you for your attention.